At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. What is the Morse Fall Scale? The Morse Fall Scale, or MFS, is a quick and reliable tool healthcare providers use to assess a patient's risk of falling. Developed in the 1980s by J.M. Morse, it's widely used in hospitals, nursing homes, and other care settings to guide fall prevention strategies. The scale evaluates 6 key factors: history of falling, secondary diagnosis, ambulatory aids, IV therapy or access, gait, and mental status. Each category gets a score, and the total, up to 125, indicates the patient's fall risk level. Higher scores mean higher risk. How does it work? Follow these steps to get started. Step 1. Get the form. Download from the Carepatron app or resources library. Step 2. Complete digitally or on paper. Digital completion is best for easy record keeping. Step 3. Follow the instructions. Assign scores for each category. Step 4. Add up the total. Determine the patient's overall fall risk. Step 5. Interpret the result. Use the guidelines to plan care and preventive measures. What are the benefits of using the Morse Fall Scale? The Morse Fall Risk Scale is one of the widely recognized fall risk assessment tools in various settings. It helps prevent inpatient falls and improves care quality. Effective for hospital patients. Predicts falls and supports targeted interventions. Valuable for elderly care. Identifies specific risks in long-term care settings. Adaptable. Works in many healthcare environments worldwide. Encourages teamwork. Simple scoring promotes clear communication between care providers. By pinpointing specific fall risk factors, the Morse Fall Scale enables early intervention, personalized care planning, and improved patient safety across all care settings. You can learn more about topics like the Morse Fall Scale in our guides library on our Carepatron website. Visit our website and sign up for free. If this video is helpful, don't forget to like, subscribe, and check out more of our content.